Hello, I'm Lauren.
I'm Jordan.
I'm Michael.
So our 2030 project is stroke awareness and detection.
So, few quick stroke facts. Stroke is a brain attack. This all comes from the American Stroke Association. And although stroke is more common after age 55, it can also happen at any age at any time. Leading cause of adult disability. Some people who have a stroke will make a full recovery, but more than two-thirds of survivors will have a type of disability. And in the US, every 40 seconds, someone has a stroke. And 2 million brain cells die every minute during a stroke. So, for our objectives, I will be covering the situation and background. And my objective is to determine situation and background of strokes slash risk factors in PA and plan teaching activities to improve community education regarding stroke prevention.
So, increasing community awareness of stroke warning using the FAST acronym and when to call 911 is important for the community to know, as well as promoting early recognition and emergency response. Because the faster you get to it, the faster you diagnose it, the faster you can treat it. Um, and as well as assessing the community as to why frequent stroke deaths are occurring.
And then the next objective, reinforce slash education the community about smoking cessation, diet, current comorbidities, lifestyle changes, follow-up appointments, labs, and recovery goals.
Okay, so for situation, stroke is currently the fifth leading cause of death in the United States of America, proportionally affecting ethnic minorities and in impoverished groups. This is according to Healthy People 2030. Montgomery County, which encompasses Horsham, our township of priority here, another township is currently below the Healthy People 2030 goal for stroke deaths. Common conditions that increase your risk for stroke are congestive heart failure, hypertension, and obesity. Heart disease is the number one leading cause of death in Montgomery County. This is according to the statistics. Other conditions that put an individual at higher risk for stroke are also within the top causes of death in Montgomery County, or can lead to complication that increases risk, such as diabetes and smoking. All the conditions and risk factors here are preventable, so stroke education is very important in preventing these. And for the goal, stroke death is currently on the decline, shifting away from the Healthy People 2030 goal. So the Healthy People 2030 goal is to have 33.4 stroke deaths per 100,000 individuals. And currently in Montgomery County and Horsham, the current stroke deaths per individual is at 42.7 per 100,000. Okay, and background. So there are two major categories of stroke: ischemic and hemorrhagic. Ischemic strokes are caused by obstruction of a blood vessel blocking oxygenation to vital tissues, also known as ischemia. The hemorrhagic stroke is caused by hemorrhage within the brain, causing swelling of the surrounding tissue. Both are deadly, but ischemic strokes account for 87% of all strokes and hemorrhagic for the other 13. This is from Johns Hopkins Medicine. Ischemic stroke is most common in older adults with the risk factors that we spoke about before, the modifiable ones. For ischemic stroke include atherosclerosis, which is the blockage of the scarring of the blood vessels, hypertension, diabetes, obesity, and other diseases of the heart, like the ones we talked about in the prior slide: coronary artery disease, and congestive heart failure. There are several risk factors discussed in our full elicitation projects, citing risk factors in origin specifically that affect stroke outcomes. Three of them that I've listed here are a lack of walkability and public transport. It's a very car-centric community with long stretches between access to commodities within the neighborhood, which increases the risk for hyperlipidemia and decreases access to care. And that's the second point, it's difficult to access healthcare resources, especially those who cannot use the internet. There's no central location for the elderly to receive healthcare education, especially for stroke, other than the hospitals. And the hospitals are pretty spread out, so without a car, it can be difficult. And the last one, a large number of fast food options within the neighborhood. There are many restaurants that are unhealthy within the neighborhood and less healthy options, with only, I think, 3 major grocery stores. There's an average of 2.3 hospital beds per 1,000 individuals in Montgomery County, and higher than the state average amount of hospital visits per 1,000 individuals at 115. So here, I just put that in to kind of say that there's a shortage in hospitals, so preventing stroke before they get to the hospital improves outcomes. Then here I have a couple of infographics just about teaching that could be done, just some information about the normal blood pressure range, how many people have stroke, who's at risk for stroke, and the types of stroke that I went over in background. Okay.
Hello. So for assessments, I wanted to talk about the BFAST assessment because it's a very easy tool for the community to use and learn. So I have the image here. So B for balance. So asking if somebody's feeling dizzy or has a loss of balance or difficulty walking. E is for eyes. So any blurred vision or loss of vision in one eye or visual disturbances. F for face, so facial drooping or facial numbness is very common when somebody's having a stroke. A for arms, so it can be it's arms or leg weakness. So like if somebody's raising their arms up and they can't raise one up or both up, then that's a red flag. S for speech, so maybe slurring words, trouble finding words. And then T for time. So timing is key when somebody's having a stroke because, like I said earlier, the sooner you get to the hospital and have imaging done and then get the treatment that you need, then the sooner you can stop the stroke occurring. So that's a good tool for the community to learn and use. It would be like easy if we made like maybe magnets on the fridge for the community. I know a lot of people do that for like buyers and whatnot. So maybe distributing that out would be helpful. Kind of like Michael was saying earlier, the stroke death rate in Montgomery County, which Horsham is in, is 42.7, which is above the national average. And then factors contributing to that, the percentage of older adults in Habro Horsham Township is 35%, and that's more than the national average as well. So obviously, being the older adult, you're at risk for falls or accidents and not going to the doctor often because you can't get around. So it's very easy to just ignore the problems, and then a stroke can occur. Like Michael was saying earlier, high blood pressure and multiple comorbidities that you usually get when you get older occur and then lead to a stroke. The obesity rate is at 29.1%, which is higher than the national average as well. Obviously, this contributes to a stroke, like arthrosclerosis that we were talking about. And then chronic disease rates are on the rise as well. Is especially after COVID. COVID has caused a lot of complications for people. There actually been an increase of strokes after COVID as well. So, and then some symptoms can include like seizures, migraines, headaches, dizziness, like we talked about, Bell's palsy with the facial drooping, trigeminal neuralgia, and then neuropathy. And then I just wanted to point out like the healthcare access in the community and just assess that aspect of things. Um, so obviously, this is within, I think, a 30-mile radius. So in Hatboro Horsham, the closest hospitals would be in between Doylestown Hospital and Abington Jefferson. So those are the two closest hospitals. Abington is a trauma center, Doylestown's not, but they both have working ERs and can treat whatever you come in with, especially stroke. There are also multiple doctor's offices. It didn't really show that, but if there was something happening, they could also assist you with getting to the hospital. There's also Holy Redeemer and Chestnut Hill Hospital, but those are a little further, but depending on where you're at the time, those might be more convenient to you. But there definitely needs to be an increase of healthcare access because in Horsham there's only 2 or 3 doctors' offices, and in Hatboro there's not many either. So putting in more maybe urgent cares or primary care, anything to help more access in the community would be useful.
Okay, so now we're going to move on to recommendations about how to prevent strokes. So firstly, so everyone can make diet changes, which can improve your overall health. So we can talk about diet, which is an essential part of preventing stroke. So foods that you can eat, well, they recommend everything's okay with balance. So you want to do low fat dairy products, peas, beans, vegetables, fruits, salmon, tree nuts, peanuts. That's foods that are okay to eat and will help decrease your risk of strokes. And foods that increase, which you want to avoid, is processed foods high in saturated fats, foods high in sodium and sugar, red meats, fast food, alcohol, pastries, and smoking. Like Michael mentioned, there is a lot of fast food in the area of Montgomery County and in Horsham specifically that is very accessible to individuals. So it's important to prep at home and try and find affordable, cheaper options to have stroke friendly heart diets. So, again, everything's good in moderation. Balance is everything. Everyone's not going to eat perfectly. So, having a burger here and there isn't going to hurt you, but it's important to balance. And then, so exercise is also very important. So, they recommend 30 minutes 5 times a day. Every week. So, if an individual has a stroke, regular exercise is recommended, especially to prevent another stroke. But it is important before you start an exercise program, especially if you have other comorbidities, that you want to consult your primary physician to talk about your health and maybe starting less would work better for you. So just really exercise and diet is the first recommendation to prevent stroke. So we're going to move on to management of comorbidities. So according to the American Stroke Association, managing and controlling other health conditions prevents heart disease, which can lead to strokes. So, examples that increase your risk of stroke is hypertension, diabetes, high cholesterol, and obesity. So, these disease processes uncontrolled damage blood vessels that increase the risk of clot formation, leading to stroke. So, first, it's important. The first step to like reduce your risk of stroke is going to be on the slide previous about changing your lifestyle. Usually physicians will want you to try that first before putting you on a long-term medication. So, and then next, it's important to consult with your primary physician if lifestyle changes isn't working for you and you'll need to get on metformin for blood pressure, statins, and or beta blockers. So these, and it's important to talk to individuals about making sure they're taking these medications as prescribed, because if they are not taking them on time and how they're prescribed, it won't produce the effect that it's going to, which will put you at risk. But as long as you manage them and talk to your provider, your risk of stroke is greatly decreased. Okay, so my last recommendation is you want to consult with your healthcare team. It's important to go and get your physical every year. Um, Little things like when they do your full head to toe assessment, they take your vital signs, your heart rate, your blood pressure. Um, it looks at your overall health. Your physician will do a full head to toe, looking at your eyes, to your mouth, to your stomach. And most often, physicians now do labs every year to check your levels. So the CBC, which will look at your white blood cells, your red blood cells, your platelets, to see if they're in a normal range. Your lipid panel is very big, especially when it comes to atherosclerosis risk, so which plays into risk of stroke. So you want to make sure that your levels are within normal range, or if they're a little up or they're extremely elevated, you want to treat that to reduce your risk of stroke. And then there's a basic metabolic panel or a complete metabolic panel to look at your whole function of your gastrointestines. Um, and then also like thyroid testing, that can also play into just your overall health. So it's important to go check up, have a conversation with your physician, and treating your underlying health issues before it leads to higher risks like stroke. So I found a nursing journal that talked about patients who suffered a stroke are 30% more likely to get readmitted to a hospital. Patients who had follow-up appointments within 14 days reduced their likelihood of being readmitted at the hospital. So a lot of times individuals who don't go to the doctor as much come in with chest pain and they need to get treated, sometimes leading to them going to the cath lab. And that is can be a overwhelming surgery, um, which can put you at risk for other issues, which you can lead to coming back to the hospital. So, going to see your physician after you are admitted to the hospital can be very helpful in your overall health. So, we have some references here. And
I can talk more.
okay, go ahead.
So kind of like what we were saying, strokes are very preventable, and like as we've learned in our clinicals, all of our experience, that people come in and they're like, well, I haven't been to the doctor in 20 years, and they have all kinds of issues. So as long as you're seeing your physician, like Lauren was saying, like every year, every 6 months, however much you need to, it's very preventable. Just taking your blood pressure at home is an intervention that you can do, especially like the past few times that you've been to your primary. If your blood pressure is elevated, obviously they're going to want you to keep track of it at home and possibly be on a blood pressure medication like a beta blocker, like Lauren was saying. If your lipid panel is off, then they will most likely prescribe you a statin. And then for if you are pre-diabetic or diabetic, they'll most likely put you on metformin to improve your sugars and your A1C. So just seeing your doctor regularly is the most important thing that we can stress through this whole project, because from obviously, like I've said, what we've seen, like you just need to go. Sometimes it's not fun, but you need to go, you need to get checked out. And the community needs to know the importance of even just going for a yearly visit can find things that are so preventable, so easily preventable. So,
And just because you go to the doctors doesn't mean you're never going to have a stroke and treat your comorbidities. There's a lot of things that go into your risks, like genetics, that you can't, prevent. But going to the doctor and doing all the preventative care can reduce your likelihood of having a stroke, and just having the proper treatment going forward is vital. But that is our slideshow. Thank you for watching.